If you're using both medication and natural approaches to improve your prostate health, there may be some interactions you need to be careful about. Urologists emphasize that a certain type of tea regularly consumed by some men for health purposes may affect the absorption or metabolism of commonly used prostate medications, thus reducing the effectiveness of your treatment. Understanding this potential interaction can help you maximize the benefits of your treatment. Research shows that approximately 60% of men taking prescription medications for benign prostatic hyperplasia, BPH, also use some form of complementary approach, including herbal teas and supplements. This combination of conventional and natural approaches has become increasingly common as men seek comprehensive solutions for prostate health. Yet what many men don't realize is that certain natural products, particularly green tea, may interact with prostate medications in ways that can potentially reduce their effectiveness. What's particularly concerning is that green tea is often consumed specifically for its purported health benefits, creating an unintended situation where one health practice may be undermining another. Let us know where you're watching from and how old you are in the comments below. The potential interaction between green tea and prostate medications has gained increasing attention from urologists who specialize in men's health. What's consistent across these specialists' observations is that being mindful of when and how you consume green tea may help preserve the effectiveness of your prescribed prostate treatments. When researchers first began investigating these interactions, many were surprised to discover that green tea, often promoted for its health benefits, could potentially interfere with certain medications. However, as our understanding of drug metabolism has advanced, the biochemical mechanisms behind these interactions are becoming clearer. I'm Dr. Jonathan Reynolds, and for over 25 years, I've specialized in urology with a focus on medication management for men's health conditions. Today I'll share important information about how green tea may interact with commonly prescribed prostate medications. Interactions that, when understood and managed properly, can help ensure you're getting the full benefit of your prescribed treatment. Before we explore these interactions, I'd like to ask you to subscribe to our channel and turn on the notification bell. Each week, we share evidence-based approaches to healthy aging focused on practical, accessible strategies. If you're concerned about medication interactions or want to optimize your treatment outcomes, you won't want to miss our upcoming videos. The potential interaction between green tea and prostate medications is worth examining because it involves how drugs are processed in the body, specifically, how they're absorbed, metabolized, and eliminated. To understand why these interactions matter, let's first look at how prostate medications work and how green tea might affect these processes. Medications prescribed for benign prostatic hyperplasia, BPH, typically fall into two main categories: alpha blockers, which relax the muscles around the prostate to improve urine flow, and 5-alpha reductase inhibitors, which help shrink the prostate by blocking the conversion of testosterone to dihydrotestosterone, DHT. Both types of medications need to be properly absorbed into the bloodstream and maintain adequate levels in the body to be effective. Additionally, they must be metabolized at the expected rate. Too quickly, and the medication doesn't have time to exert its full effect. Too slowly, and it may build up to potentially problematic levels. Green tea contains several compounds that can influence these pharmacokinetic processes, potentially affecting how prostate medications work in your body. Let's examine the specific components and mechanisms involved. The problematic compounds in green tea. The primary compounds in green tea that may interact with medications are catechins, particularly epigallocatechin gallate, EGCG, which is the most abundant and biologically active catechin in green tea. These compounds, while generally beneficial for overall health, can influence drug metabolism through several mechanisms. First, catechins can affect certain enzymes in the liver that are responsible for metabolizing many medications, including some prostate drugs. Specifically, green tea catechins can inhibit cytochrome P450 enzymes, particularly CYP3A4, which is involved in the metabolism of approximately 50% of all prescription medications, including some commonly prescribed for prostate conditions. When these enzymes are inhibited, medications that would normally be broken down by them may remain in the bloodstream longer than intended. For some drugs, this might actually increase their effect, but for others, it can interfere with the carefully calibrated balance that makes them effective. Additionally, green tea contains tannins that can bind to certain medications, potentially reducing their absorption in the digestive tract. This binding effect can be particularly problematic if you consume green tea around the same time that you take your medication, as it may prevent the full dose from entering your bloodstream. Furthermore, green tea is a natural diuretic, meaning it increases urine production. For men already taking medications that affect urinary function, this additional diuretic effect might either counteract or inappropriately enhance the intended effects of the medication, potentially leading to suboptimal treatment outcomes or increased side effects. The specific medications most affected. Among the medications commonly prescribed for prostate conditions, certain ones appear to be more susceptible to interactions with green tea. The alpha blocker finasteride, for example, is metabolized primarily through the CYP3A4 pathway that green tea catechins can inhibit. This potential interaction might affect how quickly the medication is cleared from your system, potentially altering its effectiveness. Tamsulosin, another commonly prescribed alpha blocker, may also be affected, though through a slightly different mechanism. Some research suggests that the absorption of tamsulosin might be reduced when taken with green tea, potentially resulting in lower blood levels of the medication. For 5-alpha reductase inhibitors like dutasteride, the situation becomes even more complex. These medications work by inhibiting the enzyme that converts testosterone to DHT, but interestingly, some compounds in green tea may have similar effects. While this might seem beneficial, the combined effect isn't well studied and could potentially lead to unpredictable results or increased side effects. It's important to note that the severity of these interactions can vary significantly based on several factors, including the specific medication, the amount of green tea consumed, the timing of consumption relative to medication administration, and individual variations in metabolism. Robert, a 72-year-old who had been taking finasteride for BPH while also regularly drinking green tea for its antioxidant benefits, shared his experience. I was drinking 3 to 4 cups of green tea daily because I'd read about its health benefits, particularly for inflammation. But after 6 months on finasteride, my urologist was surprised that my PSA levels and symptoms hadn't improved as expected. When she asked about my diet and supplement use, the green tea connection came up. After adjusting his green tea consumption, moving it to a different time of day, while separated from his medication, Robert noticed improvements. Within about 2 months of changing when I drank my green tea, my symptoms started improving more noticeably. My doctor explained that allowing time between the tea and medication likely helped the medication work more effectively. What surprised Robert most was that he hadn't considered a potential interaction. I thought I was doing everything right for my health, taking my prescribed medication and drinking green tea for additional benefits. I had no idea they might be working against each other. Now I'm much more careful about timing and always mention my tea consumption to my doctors. Managing the interaction effectively. If you enjoy green tea and also take medication for prostate conditions, you don't necessarily need to eliminate green tea entirely from your routine. Instead, thoughtful management of this interaction can help you maintain the potential benefits of both approaches. The timing of consumption appears to be one of the most critical factors. Most urologists recommend separating your medication and green tea consumption by at least 2 to 4 hours. This separation allows your medication to be absorbed properly before introducing compounds that might affect its metabolism. For most prostate medications taken once daily, this might mean taking your medication in the morning and enjoying green tea in the afternoon, or vice versa. For medications taken twice daily, you'll need to be more strategic about creating adequate time windows between medication and tea consumption. The concentration of your green tea also matters. Highly concentrated forms such as matcha, powdered green tea, extracts, or supplements contain significantly higher levels of catechins than a typical brewed cup and may have more pronounced effects on drug metabolism. If you're taking prostate medications, it may be prudent to avoid these concentrated forms and stick with moderately brewed regular green tea, if you choose to consume it at all. Additionally, be aware that green tea supplements, which have become increasingly popular, often contain much higher doses of catechins than brewed tea. These concentrated supplements may pose a greater risk of interaction with medications and should be approached with particular caution. Thomas, a 68-year-old taking tamsulosin for BPH, found that moderation and timing made a significant difference. I was a heavy green tea drinker, probably 6 to 8 cups daily, including right around when I took my medication, he shares. My doctor suggested reducing to 1 to 2 cups daily and making sure to have them at least 4 hours away from my tamsulosin dose. After implementing this approach, Thomas noticed more consistent results from his medication. I still get to enjoy some green tea, which I really like, but I'm now seeing better and more reliable effects from my prostate medication. My nighttime symptoms in particular have improved, and my urine flow is more consistently stronger. What Thomas found particularly valuable was learning about the concept of medication timing in general. This experience made me more aware of how what I consume can affect my medications. Now I'm more careful about timing all my supplements and even certain foods relative to my medications, not just green tea. Let us know where you're watching from and how old you are in the comments below. While green tea is perhaps the most well-documented tea that may interact with prostate medications, there are several other herbal teas that men taking these medications should be aware of. These additional considerations might be relevant depending on your particular situation. Additional herbal teas of concern. Black tea, which comes from the same plant as green tea but is more oxidized, contains similar catechins, though in lower concentrations. It may potentially cause similar interactions, though likely to a lesser degree. The same principles of separation and moderation would apply if you're a black tea drinker taking prostate medications. Saw palmetto tea may be particularly relevant for men taking 5-alpha reductase inhibitors like finasteride or dutasteride. Saw palmetto is often used as a natural approach to prostate health and works through mechanisms similar to these medications. Combining them might lead to additive effects that aren't well studied, or in some cases, the saw palmetto might compete with the medication for the same biological targets, potentially reducing effectiveness. St. John's wort tea, sometimes used for mood support, is known to be one of the most problematic herbs for drug interactions. It strongly induces certain liver enzymes, potentially causing medications to be metabolized too quickly and reducing their effectiveness. Men taking prostate medications should generally avoid St. John's wort unless specifically approved by their healthcare provider. Licorice root tea can affect hormone levels and fluid balance in the body, potentially complicating the management of prostate conditions. Additionally, it may interact with certain blood pressure medications that are sometimes prescribed alongside prostate medications, creating complex interaction scenarios. James, a 74-year-old with BPH who was also managing mild depression, had been drinking St. John's wort tea regularly while taking dutasteride. I didn't think to mention the tea to my urologist because I was drinking it for my mood, not my prostate, he explains. But when my PSA levels weren't responding as expected to the medication, my doctor did a very thorough review of everything I was consuming. After learning about the potential interaction and discontinuing the St. John's wort tea, James saw improvements in his treatment outcomes. Within about 3 months of stopping the tea, my PSA levels started responding better to the medication, and my symptoms improved as well. My doctor helped me find other, safer approaches for supporting my mood that wouldn't interfere with my prostate treatment. What James appreciated most was his doctor's comprehensive approach. Instead of just telling me to stop the tea, my doctor explained the mechanism behind the interaction and helped me find alternatives. This kind of understanding helps me make better decisions about my health overall. The science behind the interactions. The potential interactions between green tea and prostate medications are supported by both laboratory studies and clinical observations, though it's important to note that the research is still evolving, and individual responses can vary considerably. Laboratory studies have demonstrated that green tea catechins, particularly EGCG, can inhibit various cytochrome P450 enzymes, including CYP3A4, which is involved in metabolizing many prostate medications. These studies provide a biochemical basis for understanding how green tea might affect drug metabolism. Clinical studies have shown mixed results, with some indicating significant interactions, and others showing more modest effects. This variability may be due to differences in tea concentration, individual metabolism, specific medications studied, and research methodologies. One important clinical study published in the journal Drug Metabolism and Disposition demonstrated that green tea extract significantly affected the metabolism of certain medications processed through the CYP3A4 pathway. Another study in the Journal of Clinical Pharmacology showed altered drug concentrations when medications were co-administered with green tea. It's worth noting that many drug interaction studies use green tea extract rather than brewed tea, which may contain higher concentrations of catechins. However, regular consumption of multiple cups of brewed green tea could potentially reach levels that affect drug metabolism, especially in individuals who might metabolize these compounds more slowly. Now, I want to share what might be the most important factor for addressing these potential interactions, something that healthcare providers consistently emphasize. The key factor appears to be open communication with your healthcare providers about all substances you consume, not just prescription medications. Many patients don't think to mention tea consumption during medical appointments, considering it too trivial or unrelated to their medical care. However, providing your healthcare team with a complete picture of your diet, including teas, supplements, and over-the-counter products, allows for more effective medication management and personalized advice. It's also important to approach this information with balance rather than fear. Green tea offers many potential health benefits, and the goal isn't necessarily complete avoidance, but rather thoughtful integration with your medication regimen. Working with healthcare providers who understand both conventional medications and complementary approaches can help you develop a plan that maximizes benefits while minimizing risks. Michael, a 79-year-old taking both tamsulosin and finasteride for BPH, emphasized the importance of this comprehensive approach. I now keep a list of everything I take or consume regularly, medications, supplements, teas, everything, he shares. I update this list before every doctor's appointment and bring it with me. This has helped my various doctors coordinate my care more effectively and identify potential interactions I wouldn't have thought of. What Michael found most valuable was the personalized guidance this approach enabled. Instead of general advice, my doctors can give me specific recommendations based on my complete health picture. For instance, my urologist suggested I could still enjoy green tea, but recommended specific timing and limits based on my particular medications and dosages. For those concerned about potential interactions between green tea and prostate medications, I recommend discussing this specifically with your healthcare provider. They can offer personalized guidance based on your specific medication regimen, overall health status, and treatment goals. While waiting for that conversation, adopting a conservative approach, separating green tea consumption from medication times by at least 4 hours, may be prudent. Remember that these considerations apply not just to brewed green tea, but also to green tea extracts, supplements, and green tea containing energy drinks or functional beverages, which may contain even higher concentrations of the active compounds. It's worth noting that while we've focused on green tea in this discussion, the principles apply more broadly to the potential for interactions between natural products and prescription medications. Approaching your health with an integrated mindset, one that carefully considers how different aspects of your regimen might interact, can help you achieve better overall outcomes. Let's summarize the key points about green tea and prostate medication interactions. Green tea contains catechins, particularly EGCG, that can inhibit enzymes involved in metabolizing many prostate medications, potentially affecting their effectiveness. The tannins in green tea may also bind to certain medications, reducing their absorption if consumed together. Medications particularly susceptible to these interactions include finasteride, tamsulosin, and dutasteride, though individual responses can vary. To manage this potential interaction, separate green tea consumption from medication times by at least 2 to 4 hours. Consider moderating your green tea intake, especially avoiding highly concentrated forms. Discuss your green tea consumption with your healthcare providers. Other herbal teas, including black tea, saw palmetto tea, St. John's wort tea, and licorice root tea, may also interact with prostate medications through various mechanisms. Open communication with healthcare providers about all substances you consume, including teas and supplements, is essential for effective medication management. By understanding these potential interactions and working collaboratively with your healthcare team, you can develop an approach that allows you to potentially benefit from both conventional and natural approaches to prostate health without one undermining the other. While no approach to managing medication interactions is perfect, being informed and proactive can help you maximize the effectiveness of your prostate treatment while still maintaining flexibility in your dietary choices. The goal is not to create fear but rather to empower you with the knowledge needed to make thoughtful decisions about your health. If you found this information valuable, please consider sharing this video with friends and family who might benefit. Many men take both prostate medications and consume green tea or other herbal products, unaware of the potential interactions. Subscribe to our channel for more evidence-based approaches to healthy aging, and tap the notification bell so you never miss an upload. Each week, we explore different aspects of well-being for older adults, always focused on practical, accessible strategies. Thank you for joining me today. I wish you vibrant health and well-being in the years ahead. Until next time, take good care of yourself.